Good morning, good morning, good morning, everyone. How are you? I've been in the mountains for a week. Youngest son had to get married again, and so took a little trip up into the mountains and the little chapel things, But need to get some mountain air down me. So I went up to Gatlinburg, Tennessee, a little party town. Saw some pretty cool things up there this time. But anyway, saw some bears in the woods, mama, papa, and little babies too. How are you all doing? I hope you're doing well. I have to catch up on all the weeks past. I hope this finds you all well, and everybody moving along the road well. I hope you're all meditating and working with the now and setting that ego and that mind to the side when you remember it. To trip, to really trip. But it is definitely a pleasure, and real humbling to deal with so many great souls out there like yourselves, and all the work you're doing. Through the years, there's a lot you'll see as you go along and helping all these people. The rewards and the ups and downs that has, so many sick people. It's unbelievable, and I'm so proud of every one of you that are working with others. There's nothing more joyful and rewarding as giving, because the old adage, you give, you get when you give. And it's like when you open up and start giving, it just floods through you. And so it teaches you to just totally let go and give, and because you are never going anywhere, and you can't ever lose yourself. The illusion of the lower worlds of materiality, if you will, or of the negative forces, if you will, is that if you don't use the mind, you'll stop existing. You got to use that mind. No, you don't. Anyway, want to go on down the line here and try to catch up here a little bit. I appreciate not overwhelming me with questions while I'm gone, because it's getting caught up is the problem. And I definitely want to address those of you that are really suffering, and appreciate all the positive comments, and just love you all. And this is an interesting way of life, and you have to look at it as a way of life, because you must incorporate this as a way of life. And I think people, if they will set their past aside and enter this new genre, this new realm, this new age of thinking and expanding oneself, and being happy, and getting back to some fundamentals that help us to interact with each other better. Sad that we have to fight each other so much. It's just a sad thing, because most of the disagreements are on petty things, actually, and not really on substantial things. But I want to go on here. Appreciate the picture there, dude. Another rock and roller, or blues, rhythm blues. Wonder who's going to win American Idol. I think it's going to be the black guy. Nobody blows those pipes like that black guy. What's his name? Not Jason, but man, is he good. Holy crap. The young Asian lady is extremely good, too. I liked Holly, but I also like Philip. Of course, I'm a fan of that type of music. Anyway, thanks for your comment, bro. Ouija board. I do see your eyes here. Some of the longer email questions are harder for me to get to, because of just so many of them here. But your eyes here, looking at them, my friend, definitely the right eye. You're definitely in the stomach and GI tract. You want to clean that up. Definitely get that lymph moving. Right kidney, definitely got to rebuild that. Got some issues going on in there. And also I'm either looking at bladder or lower back. That's the black, you see it around 5 o'clock. That's either bladder, lower back, coccyx area there. Can't tell unless I really map this out. Pupils look a little bigger than they should be with the light in there, which is central nervous system. but definitely the kidney and adrenal on the right side, not very happy there for you. And I look to the left side, not much better. So really need to work that out. Definitely interstitial lymphatic constipation, malabsorption. Look at your picture, kind of confirms that, but then looking at this definitely shows that as well. Looking at some groin or hip and right testicle, perhaps, left testicle perhaps, mid to upper back left side. Hard to see this distance away from the eye. Our pictures are really up close, as most of you have already seen. Our pictures are more like that, and hard for me to see when they're like that. But it's enough to see some things, and enough to say that GI tract, and the most common, most of you realize this by now, the most common areas to focus on is the GI tract, no question, the trunk of the tree. I mean, everything springs off of that almost. So the GI tract is vital, and a lot of people just think about cleaning off the wall of the GI tract. And really what you're trying to do is reach through the wall interstitially and get into the lymph system again. Now we got to clean the wall off, got to strengthen, but to strengthen we have to remove that which weakens. It's just common sense. That's what weakens tends to be the acidic side of chemistry as opposed to the base side of chemistry. You can get real base, but mostly I feel that we're dealing in acidosis as opposed to alkalosis. But again, you have theories and everything else. So I'd head off on that GI tract. Obviously, the lymphatic system is the other thing that we focus on. So if you focus on your GI tract, you focus on your lymphatic system, and that includes the kidneys and adrenals. That's a vital part of that system, and all the endocrine glands. When that's the central focus, brother, there's not much you can't cure. I can tell you, when you couple the raw food diet and deeper levels of fruitarian or fasting on fruits, if you want to use the word, because fasting isn't appropriate when we're talking about living on fruits. That's just a fruitarian lifestyle, it's not fasting. To many it appears to be fasting, and it's okay that we use that if you like. But it's digging in and moving this gigantic lymph system, and you all are doing a fantastic job of doing that. A bit of a trip, you know, hang in there. Sometimes it takes some people months, if not years, to regenerate their body, but what else you got to do? You know, you might as well head into it and enjoy that, you know, because joy and happiness follows that, spirituality and all of that. Lucy, let's see, I've been watching your videos and have ordered your book and some of the formulas. I am in a lot of pain. 4 years ago, I've injured one of my muscle attachments to scapula. I have never recovered and had problems just when sitting long hours. And so when you start seeing things like that, you know that one, when trauma to tissue is not healing, you know immediately the lymph system's involved. Who cleans up the mess? The lymph system, not the blood. Your blood's not having a problem flowing. That's ridiculous. This would be the lymphatic system, and this would be the retention of acids in those tissues, resulting in the inability of those tissues to repair themselves. You also might look, of course, at the parathyroid gland. What I love about you guys is that the smarter you get, it's just going to be really tough out there on most practitioners, because you guys are getting one major dose of education here that's going to take you way above most practitioners in your healing abilities. I love that, to tell you the truth. So keep yourselves fit, keep yourselves helping others and detoxifying others, and giving that love out there, and become some of the greatest healers that this planet has ever seen. And a lot of you are heading down that pathway. I love it. Just can't wait. So this is what you're seeing there. They told me that it is very light treatment, which, let me see here. I have nearly recovered and had problems just with sitting hours. I went to a doctor and they performed a laser treatment. Now again, what are they trying to accomplish with these type of treatments other than the damage of more tissue? You see what I'm saying? And their theory is kill more cells. It's kind of like our government. Borrow more, spend more. That'll make everything work better. Well, medical doctors think the same way. Kill more cells. I mean, it's all back-asswards. I mean, it's just all ridiculous stuff. And it's like we've got to get people's heads turned on properly here. You don't destroy tissue to regenerate tissue. That's an oxymoron. The treatment lasted 8 weeks. It was painful, and they told me to continue, and that it'll eventually get better, I guess. However, since the treatment 6 months ago, I have been in a lot of pain. No kidding. Because the problem is, even from a laser treatment and damage of tissue, you're not even cleaning that and repairing. They don't get that. They just don't get that. And we get that, and we got to fix that. So you got to move your lymph, dear one, and that side of your body that is on is showing you that that kidney is in more trouble than the other one, obviously. I have been trying juice fasting and juice fasting. We'll keep digging in, get on the herbs. All I can tell you, you'll see the night and day difference when you get on the botanicals. I don't know what to say about it. You know, I found that was the magic, you know, and the herbs are everything, I think. I've been always very thin, but now I am really thin and very, very weak. Well, that's because you're running into the adrenals and your autonomic nervous system. You're not on any stimulants. You're on pure energy and nutrition. Well, you know, that really brings about the genetics and shows you where you're at. Thin, malabsorption, of course, obviously, or pancreatic, or both. So we really want to work on that gut. This shows you that the lymph's backed up, you're malabsorbed. Again, the adrenals are down because of the fatigue, and that just is the link to the kidneys and the lymph system there. There's your link. I tried to reduce medication, but feeling a lot of pain. Absolutely. And I would do, Lucy, I'd do some castor oil packs on that shoulder. And wherever your problem is, do castor oil packs. That'll help you. We're trying to get our Hill-All salve back online again. You could do a poultice of Hill-All tea or the herbs from that after you boil them down. But internally, you really want to go after your lymph system, and that's going to go into the kidneys. You're going to do a lymphatic 1 capsules, I would, for the GI tract. I'd also do a stomach and bowel. If you're not having too many bowel movements a day, get on that GI broom. I heard we had it in, and now it's all gone, so I don't know. But anyway, we're trying. So hang in there and keep working on that. Keep digging into that. Get that kidney capsules, even 2 kidney formulas if you can. Parasite M I would do. Go after those adrenal glands. Either do a cytotrophin, a glandular, or do if you have real low blood pressure, you can get by with using the herbal formula. And go after that pain. I mean, go after that lymph system. That's the system where the pain is, just holding it there. And nothing ever good comes of that, because further deterioration of that area will exist if you don't get that lymph moving and get these acids out of there. This just shows you that you can't go in and damage more tissue to fix tissue that are already inflamed and damaged. And that even accentuates the pain and creates more problems. And that's all the medical doctors have really done. And a lot of people don't get this, that they've created more problems. And more. They've created so many problems for the human species in terms of their health issues, it's not even funny. And yet, you know, every day they get praised for something. And it's like, oh, excuse me, guys, you need to refocus yourselves and quit hurting people and learn the truth. And then maybe all of us healers can work together and things will be good. Scorpio 662, Dr. Morse, I have heard you dozens of times talk about how the adrenals control the kidneys, but in over 500 videos I've seen, you've never taken the time to explain exactly how. You know, I have neurotransmitters, especially the dopamines and the acetylcholines. When you take a look at that, in nursing we use dopamine to increase kidney flow. So when you look at neurotransmitters and you look at epinephrine and norepinephrine, these are your adrenalins. They're going to dilate your blood vessels, they're going to dilate your bronchioles, they're going to increase thyroid function to pick up. You know, it's adrenaline. It picks up the sympathetic. It just picks the sympathetic up, which picks up